Good morning all. Today we are going to discuss on manpower planning. Let's see the introduction. Manpower planning is considered as being central in personal administration. So if you're seeing an organization, manpower plays a crucial role in that administration. Manpower for health is crucial for the healthcare delivery system. If you're seeing one hospital manpower, it means the employees plays an important role in that healthcare delivery system. They are least strategically planned element in most healthcare systems. Even though the employees, if you're taking the hospitals, the nurses plays a significant role, then also they are least strategically planned in many healthcare systems. This causes several mismatches and imbalance in the healthcare workforce. If the staff nurses are very less when compared to the inpatient number, there will be many mismatches and imbalance in the healthcare workforce. Planning for provision of proper quality and quantity of care to different categories of patients in the hospitals are one of the main responsibilities of a hospital administrator. So it is the main role of the hospital administrator to plan and provide proper manforce for providing quality and quantity care to the patients who are coming to that hospital. Now, what is the meaning of manpower? The term manpower has different meaning in different aspects, but the concept is same. It is taken equivalent to labor or human resource or employee. So manpower means it can be the labor, or it is also considered as human resource in a particular organization, or simply we can say the employees who are working in an organization is known as manpower. It is the sum total of inherent abilities, acquired knowledge and skills represented by the talents and aptitudes of the employee germ. So the manpower means the abilities and acquired knowledge as well as the skills of a labor or of an employee whom we are selected in our organization. Manpower planning is basically concerned with the determination of the process or movement from current manpower position. So now you know what is manpower and what is known as manpower planning. It is the determination or the process of movement from the current manpower position. In an organization, if you found that there is significantly less number of employees when compared to the patients that are admitted in the hospital, the organization need to plan the manpower, or they need to improve the manpower in their hospital. So that kind of planning is known as manpower planning. Now, the definition of manpower planning. Manpower planning is defined as the process by which management determines how the organization should move from its current manpower positions to its desired manpower position. So, the planning includes how the management can move from its current manpower positions to a desired manpower position to attain their particular goals in a given period of time, that is given by vector. Next, the manpower planning is defined as the strategy of acquisition, utilization, improvement and retention of an enterprise human resource. So it is also considered as a strategy of gaining, acquisition, utilization and improvement and retention of the human resource in a particular organization. That is given by Reed UV. And the last one is manpower planning means forecasting the number of people whom the organization will have to hire, train or promote in a given period. So it is a type of forecasting the number of people or the number of employees they want in their organization through the training or hiring or requirement to promote the goals or to attain the goals of an organization at a specific period of time. So it is given by Stiles and Styrus. Moving to the need of manpower planning. First is it fulfill the need of organization to accomplish its goals. So while doing the planning itself, with the organization or the manager will able to know about the need of manpower in the organization, so they can fulfill or find or bridge the gap in the employees in that organization through the planning process to replace the employees who retire, have physical or mental ailments. So in the planning itself, the manager can see who all employees got retired and is there any employees with physical or mental ailments are present in our organization, and if they diagnose any kind of problem, they can even replace these employees with a new one. To combat the turnover, if there is more turnover in a particular organization, they can take the new employees through the recruitment process to meet the needs of changing and expanding demands. As you all know, there is many external factors like technological advancements and societal factors also that concern with the organization growth. So according to that, the organization needs to recruit the employees who are very technically skillful. So depending on the technological improvement or technological changes, the organization need to take the new employees who are very skillful in that technology. To meet the challenges arise due to the changing technology that I have explained in the previous point, to identify the areas of surplus personnel or the areas in which there is a shortage of personnel. So during the planning process, the organizer will able to know the areas where there is a surplus person or the areas where there is a shortage of employees. So these type of planning will help the organizer or the manager to make a change in the organization in the areas where it is needed. Coming to the aims and objective, first to resource the nursing manpower. So the organizer get a chance to provide enough nursing manpower to the hospital through the planning process to seek a balance between the available human resources for health and what is actually required. So the organizer get an opportunity to find out the balance between the available human resource present in the organization and what is actually required to give proper care to the patients. To assess the nursing personnel need in future, it also helps the manager to find out the number of nursing employees needed in future for the proper going of that organization. Sorry, to make plans for recruitment and selection. If they find out any imbalance in the number of employees present, they can even plan for the recruitment and selection to bridge that gap. To assess the skill requirements in future, they can find out the areas where the hospital need the skillful employees to draw up action plan to match the supply to demand. If they're finding out any shortage in a particular specific area, they can draw up an action plan to take recruitment and select the proper and skillful employees. To attract quality nursing personnel, by the recruiting process, they can attract the skillful and knowledgeable nursing person to a particular organization. To use existing nursing manpower optimally, if they are not able, if the manager or the organization is not able to done a current recruitment process by the planning, they can even use the existing nursing power to give a proper care to the patient. To value the nursing personnel, even this main objective of manpower planning is to provide the maximum or to give provide the value and respect that the nursing employees is needed or supposed to get from each organization. There are some more points to promote the employees relationship. So in a planning process itself, the organization and the employees will get a good relationship with each other to retain the nursing talents in an organization. If there is a proper manpower planning, there will not be workload more over on the employees who are working there. So the organization can retain the talentful and skillful nurses in that organization to promote the nursing personnel in a systematic manner. As I said, if the organization or the management is going through with a good manpower planning, the nurse personnel will always be consistent with the patient ratio. It promotes the nursing personnel in a systematic manner in providing holistic care to determine training and development needs of an organization. During the planning, if the organization found any kind of training or development is needed to the employees in a specific area, even they can arrange that type of in-service educations in the organization itself. Now let's see the importance of manpower planning. First, the reservation of nursing talents. The organization can have reservation at any time with record skills and experience those can be available. So by through the proper planning, the organization can reserve the talentful and skillful nurses in their particular organization, defining the future nursing personnel in need. Manpower planning defines the future requirements of nursing personnel and also has the basis of recruitment and selection. Otherwise, there will be a mismatch. So, in the planning, if they found any shortage of their employees to provide the good care, they can even start the recruitment and selection process to reduce the mismatch of the employees and the care that is supposed to give to the patient. The third one is cope with the changes. Manpower planning helps to create a balance in the situation where there is a demand to cope up with the changing technology. As I explained in the previous slide, there is a huge technological changes day by day. So the organization also needs the employees who are very skillful and knowledgeable in the technology. So the organization get the opportunity or even they can recruit the persons who are very skillful in the changing technology. Minimizes the cost. The sound manpower planning facilitates the preparation of appropriate human resource budget for each department and planning advance. If an organization having a good planning department in manpower, they can even facilitate the preparation of appropriate budget for human resource in each department and plan in advance about the recruitment and process. In that way, they can minimize the cost for manpower in some extent. Form a base for developing talents. Because of increasing emphasis on knowledge oriented personnel, the employees are keeping up to update to get higher jobs. In every organization, they give more emphasis on taking the employees who are very knowledgeable and skillful. So in that case, each person or each employees try to get up to date about their knowledge to get the higher jobs. So it acts as a base for developing the talents of employees. The last one, efficient utilization of nursing personnel. Sound manpower planning has a scope of planning how to best utilize the existing nursing personnel. If an organization is finding that there is shortage of employees in an hospital and they are not able to take a recruitment at a moment, even they can plan to utilize the present scenario or present nursing personnel in a proper management to maintain or to balance the care that they need to give to the patient. Next, it helps to improve the work culture. Clear communication, effective supervision, and leadership are the concern in good working environment. For a good working environment, there should be a good communication between the management and subordinates, and even there should be effective supervision and leadership by the manager to a proper running of an organization. Manpower planning also includes training and development of the personnel which leads to cooperation and better human relations. So manpower includes proper training and developmental programs among the employees to attain their goals in a specific period of time. So it improves the work culture in a particular organization. Next, quality patient care. The patient's care improves when the nursing personnel are utilized in the best possible manner that results in minimum wastage of time, money, efforts, and energy. So, in an organization, if there is a current, if the nurse-patient ratio is proper or it is good or it is maintained in a proper management, the hospital can provide the best nursing care to the patients who are coming to that hospital. Even it can result in minimum wastage of time. There will be less burden on the present working employees and less efforts and energies they need to put to give the quality care to the patients. Moving to the manpower planning process. So there are some steps in the manpower planning according to the whole viewpoint. The first, data information on manpower situation. First, the organization need to collect the information on the present manpower. Second, forecasting the manpower demand and future supply. They will be able to identify the manpower demand and in future what level of manpower they need to improve in their organization. Identify the manpower mismatch between the demand and supply. They will be able to know about the mismatch that is present between the present employees number and the demand. Detailed planning based on organization and management policies. Once they found the mismatch between the present and the demand they needed, they can make a detailed planning based on the organization policies and philosophies. Once the planning is made, they need to start the implementation. They need to start the recruitment process to select the skillful employees in that organization. Once the employees are selected, the process is not stopped there. They need to evaluate if the process is going in a suit manner. Now let's see the manpower planning at organization level. It is a process of determining the manpower requirements. So it is a process of knowing the manpower requirements in an organization and meeting of those requirements in order to carry out the integrated plan of the organization. So we will able to know about the manpower requirements in that organization and meet those requirements to carry out all the goals of an organization. The process of nursing manpower planning for a single health organization is different than the national manpower planning. So for each organization, the manpower planning can be different. The basic step will be almost remain the same. The objectives may be almost same, but the nature and the scope of nursing manpower planning differs. That always depends upon the size and the type of activities required by the organization. For all organizations, the nursing manpower planning can be different, but the nature and the objectives will be almost same. So planning will always depends upon the size of the hospital and the activities that they need to carry out in that organization. The nursing manpower planning mainly consists of 5 steps. First, determination of nursing service objectives to find out the objectives. Second, forecasting the nursing manpower that is required in that hospital. Then, supply the estimates, find out the estimate nursing manpower needed in that hospital. Then, based on that, make an action plan to provide the enough employees to that hospitals. Then, planning of manpower management methods. Then, they will provide or they need to plan the management or the manpower planning methods for the recruitment process. Moving to the planning manpower management methods, according to Trend Health in 1991, he given some phases, that is short term, medium term, long term and operation term. Short term means they are ensuring the sufficient staff to cope up with the expected workload. So here they are finding if the hospital having the enough employees to cope up with the expected care that is given to the patient. The medium term means they utilize the present nursing personnel to carry out all the works in the changing environment. They are not at all taking any recruitment process. They are utilizing the present current employees to carry out or to provide the care to the patients. Long term means this phase relates to the manpower planning, whereby decisions are being taken in longer term regarding staffing for a defined areas and may necessitate major strategic change. In this level, the organization will recruit the new staff, place the staff in the specific areas to carry out the care for the patient. Next is the operational level. This phase relates to the decisions taken about the deployment of staff, that is actually to enable the team to cope up with the immediate workload requirement. So here they will deploy the staff to a team of employees to cope up with the immediate workload in that situation. So these are the 4 phases: short term, medium term and long term and operational term, which is given by Trend Health. In this section, we have discussed regarding the manpower planning, its meaning, definition, need, aims and objectives, importance and different planning methods. And I hope you are all clear about this topic. Thank you for listening.